Hello, Dr. Darty here, ready to get to the heart of the matter. Today we're going to say a few words about the heart and the circulatory system. There are whole books written on this topic. People go to school for years on end to learn about this topic. So clearly we aren't going to learn everything there is to know about the heart and blood vessels today. But we'll go through some basics. I'll try to put up some helpful links for you for both cardiac anatomy and some of the other terms that we'll be talking about. If you're going further along in EMT nursing, you're going to learn a lot more than what's included in this chapter in your book. It's done very well. But we'll try to get some basics down. When I taught A&P, my students loved learning about the heart. They consistently said it was their favorite topic. I think there are a couple of reasons for that. For one thing, the heart is just so cool. It is such a nifty design, and it works so well and so tirelessly. I'm 67 years old, and my heart has been beating faithfully since before I was born. And unlike my leg muscles, which after a long run or bike ride are screaming for a break, it has never taken a break, and I hope today is not the day it decides to do so. Also, I think that once students mastered the heart, the flow of the blood through the heart, the names of the valves and the chambers, they just felt competent, and that's such a good feeling. So I hope that at some point in your career, you will feel like you can trace the flow of blood from the body to the heart, to the lungs, back to the heart, out to the body again, and that you can do it real confidently, because that will help you understand medications. It'll help you understand why doing CPR correctly is so important. It's a really good thing to know if you're into healthcare. All right, let's start. And I wish I had a model here, but I'm not in a lab, clearly, so I don't have one. But you might want to refer to the diagrams in your book, which are very good and not too complex. Like all mammals, we have a four-chambered heart. It lies behind our sternum or breastbone, a little to the left. The pointy tip of it is called the apex, and the flatter top of it is called the base. The heart has four chambers. Two upper chambers are called atria, singular atrium, and they are to receive blood. The right atrium receives blood from the body, and the left atrium receives blood after it receives oxygen from the lungs. The lower two chambers are called the ventricles. Notice how it's spelled. Students, for a simple word, they often misspell that. It ends in CLE, like your uncle, not another way that we won't even mention. So you have a right and a left ventricle, and they have thicker muscled walls, and they are like mighty pumpers, mighty pistons. The right ventricle pumps blood out to the lungs so that it can pick up oxygen, and the left ventricle pumps blood out to the body. There's a wall or septum between the two atria called the interatrial septum. That means between. Inter and interstate highway goes between states, so inter means between. So the interatrial septum is the wall between the upper chambers, and the interventricular septum is the wall between the two lower pumping chambers. Pretty clear so far? We'll mention while we're there, one common heart defect, perhaps one of the most common congenital heart defects that little kids are born with, is a tiny hole, sometimes a big hole unfortunately, between the pumping chambers. That would be a ventricular septal defect, a hole, or a VSD. Just a little aside. All right, let's talk about the blood vessels that either come to the heart or that direct blood away from the heart. The blood vessels coming in to the atrium on the right side, bringing blood back from the body. There's two main ones, the superior and inferior vena cava, means big old vein. The vessel bringing blood back from the lungs to the left atrium, there are four of them, right and left pulmonary arteries. And they're called pulmonary because they come from the lungs. Now, leaving the heart from the big pumping chambers, that gets a little easier. As you would expect, on the right side, the pulmonary trunk, which splits into right and left pulmonary arteries, carries blood from the right ventricle out to the lungs. And you're probably familiar with this one, the left ventricle sends blood out to the body through the mighty aorta, the biggest artery in your body, big as a garden hose. All right, so those are the main or great vessels. They're sometimes called the great vessels of the heart. The only thing left to learn is the valves. So what are the valves in the heart and why are they there? Well, the valves keep blood flowing in only one direction. As you would imagine, for a pump to function efficiently, we don't want blood to flow backward. We want, with each contraction, word for that is systole, we want the blood to go only the direction it ought to go, not to backflow. So we have two different valves that separate the atria from the ventricles. On the right side, that is called the tricuspid valve. And the name is pretty much self-explanatory, tricuspid, because it has three little leaflets or cusps that seal very tightly so that when the right ventricle contracts, blood goes only out through the pulmonary trunk, not back up into the right atrium. On the left side, between the atrium and the ventricle, we have the bicuspid, because it has two cusps, valve, sometimes called the mitral valve, more often, honestly, in healthcare referred to as the mitral valve. Bicuspid and mitral valve are the same thing. Mitral is, if you know what a bishop's mitre, the Pope say when he has on his most fancy hat, it has two cusps. If you look at it from the side, it's sort of pointed. I can almost make one with my hands. So because the mitral valve has two cusps, it looked to the early anatomists a bit like a bishop or the Pope's mitre. That's the name for that tall, pointy hat. And so it's called the mitral valve. Now, the mitral valve and the tricuspid valve are collectively called the AV valves, standing for atrioventricular. The valves that take blood out of the ventricles to the lung and the body look like little half moons, their leaflets do. So collectively, they're called semilunar valves. The right semilunar valve, which directs blood toward the lungs, is called the pulmonary valve. Yay, that one's easy. And even easier, the left semilunar valve, the one that takes blood out into the aorta, is called the aortic valve. That's really pretty much, as far as the internal structure of the heart, what you need to know. Now, the heart has three layers. The epicardium, remember epi means upon. The epicardium is the outermost layer, a thin layer. The thick layer of muscle of the heart is called the myocardium. You remember that myo means muscle, so myocardium means the muscle of the heart. And you may have heard someone say, oh, this unfortunate soul had an MI. Well, an MI stands for myocardial infarction. It means that the heart muscle actually died because it was deprived of blood. More on that later. Let's see, where we're going. The innermost layer of the heart is called the endocardium. And you may have heard of someone having endocarditis. That's where someone gets a bacterial infection, typically involving the lining of the heart, a very serious situation. So endocardium is the smooth lining of the heart that allows the blood to pass through, almost like a skater on a skating rink. It's very slick, so blood doesn't pool there. All right, we also have, let's see, what do we want to think about? Blood vessels that serve the heart itself. And that is called the coronary circulation. It's really a third little circulation that serves the heart. The first blood vessel off the mighty aorta is the coronary arteries. And the coronary arteries are so called because they encircle the heart like a crown. So coronary means like a crown, and the coronary arteries encircle the heart and provide blood to the heart itself. You can think of it a bit like when you fly on a plane, you are reminded that should the oxygen masks drop, that you need to put yours on before attending to your child or anyone else who might need assistance. Well, the heart sort of looks at things the same way. It gives itself oxygen first, because if the heart was deprived of oxygen, the rest of the body is, in an unfortunate situation. Okay, so that's coronary circulation. When someone has a heart attack, to use the common language, or a myocardial infarction, it's because a coronary artery, some or all of them, have become, its branches have become occluded, typically by plaque, a buildup of fatty sludge and platelets in that vessel, or that a bit of clot has broken off from somewhere else and occluded that blood vessel. When that happens, if no oxygen gets to the heart muscle, the part served by that branch of the coronary artery dies. And that's what a myocardial infarction or coronary is. Okay, the rhythm of the heart. How does the heart know how to beat? Well, high in the right atrium, there's a group of very excitable heart muscle cells that are collectively called the SA node, sinoatrial node. And in a normal functioning heart, the SA node serves a little bit like if you've watched in the Olympics the crew teams rowing. The person who doesn't seem to be working quite as hard has the megaphone in the back of the boat and is saying stroke, stroke, stroke. I think that person's called the coxswain. Well, the SA node sort of serves that purpose for your heart. It sends the signal to all the other myocardial cells to stroke, to beat. And in a normally functioning heart, this is going to happen somewhere at rest between, 60 to 90 beats per minute, depending on how old you are and what kind of shape you're in. So if that stops working properly, and there are a lot of reasons that can happen, genetically, usually because of age, then it's like who's in charge here? Who's going to tell the heart when to beat? Most often what happens is other atrial cells just sort of go a quiver, if you will, and that's called atrial fibrillation. I know you've heard the commercials recently on TV for a drug that you can take if you have, quote, AFib. That stands for atrial fibrillation. When the atria are not contracting smoothly, because they're receiving chambers, it provides an opportunity for blood to pool and clot, and that's why people who have AFib often need to be on a, quote, blood thinner or anticoagulant to keep blood from clotting. And that's what you see the commercials for frequently now on television. So the SA node should be keeping time. If it doesn't, we could have AFib. If it's just completely out to lunch, not doing its job, what can happen is that the heart, let's see how to put this, don't want to be too complicated, another group of cells further down in the chain of command takes over. But those cells are not quite as good at the job, and they tend to cause the heart to beat more slowly. When that happens, we get what's called bradycardia. Bradycardia means that the heart is beating slowly, slower than normal. And that slower beating may not be sufficient to perfuse the body appropriately, including the brain. So people who have an SA node that's not doing its job, another group of cells try to take over, but they don't do the job so well, that person may actually pass out. We call that syncope, SYNCOPE, a syncopal episode. If you know perhaps an older relative who's had to have a pacemaker inserted, that means that we're artificially taking over the job that the SA node should be doing. There's lots more that some of you have already learned about the conduction system of the heart and how the heart's rhythm is maintained. But we've mentioned bradycardia, that's a heart beating too slowly. Let's also mention tachycardia. Tachycardia means the heart's beating too fast, and there can be a lot of reasons for that. too much coffee, a thyroid gland that has gone berserk. There are a lot of reasons that a person could have tachycardia. A fever will cause tachycardia. So an increase above normal in heart rate is tachycardia. A decrease below normal is bradycardia. Now, when the heart is actively pumping, when the ventricles are squeezing, your blood pressure goes up, and that's called your systolic blood pressure, and that squeezing action is called systole, taken from the Greek, S-Y-S-T-O-L-E. When the ventricles relax, your blood pressure drops for a moment, and that's your diastolic blood pressure, because that resting phase is called diastole. Two more important terms. Our heart can also beat irregularly. Sometimes those are inconsequential. I think most of us have felt our heart skip a beat or do a little flip-flop. That's usually caused by what we abbreviate as a PVC, a premature ventricular contraction. It's where the ventricle just didn't get the signal or decided to go off on its own for a second without listening to the SA node, so you get a little extra beat or an abnormal beat. Most PVCs are completely innocent unless they happen too frequently. Another kind, a much more serious kind of arrhythmia, is ventricular fibrillation, or VFib. You might picture, again, back to talk about our Olympic rowers, our crew team, for the boat to move efficiently, everybody has to stroke at the same time. How would the boat work if everybody just put their oar in the water whenever they felt like it? Would the boat move? Probably not. The same is true in your heart. For the ventricles to contract effectively, all those little heart muscle cells have to squeeze at the same time. If something goes terribly wrong, and it's beyond our scope here to talk about what those things could be, but something goes terribly wrong and all those little muscle cells, instead of squeezing together, sort of squeeze whenever they feel like it, then what you get is a wiggling, ineffective movement of the ventricle, and it sort of just quivers, and that's called ventricular fibrillation, or VFib, a true emergency. For those of you who like to watch medical shows, you know the producers of those shows love to show what we call cardioversion, or shocking. That's where they take the paddles, put them on the chest, and give the heart a big jolt of electricity to hopefully make it snap out of that wiggly thing and just start contracting normally again. You'll learn more about that further on in your careers, but that's called cardioversion. Let's see, what else do we want to talk about that's important? Let me check the book because there were a few terms I wanted to make sure. Let me get it. Oh, we didn't talk about the pericardial sac. That's an important thing to know. Your heart within the chest sits in a little membranous structure called the pericardium. Sometimes, if the pericardium is infected or inflamed, we call that pericarditis. It's a very painful condition. Another thing that can happen relative to the pericardium is if it's pierced and it fills up with blood, typically, what you would see is a situation called tamponade, or some people say tamponade, but most healthcare professionals say cardiac tamponade. What happens if you picture the heart sitting in a little baggie, which is what the pericardium is, if that baggie fills up with blood and pushes on the heart, it can't fill appropriately to be able to pump the next pump. So if it can't fill, if it's constricted because the baggie is filling up with blood, that pericardial tamponade is a dire situation. Another one TV producers love, because you've probably seen that. It's very dramatic. Someone plunges a big needle and syringe into the chest and withdraws the fluid, typically blood, to relieve the tamponade. So you'll learn more about that later too. Doesn't happen as often in real life as it does on TV, but it does happen. EKG or ECG. That always confuses people. In the old days, they used EKG because the Greek spelling through the German was cardio with a K. That didn't really make sense in today's world. So now if you walk through a hospital corridor, you may see ECG lab. But an ECG, usually used by younger professionals like you will be, is the same thing as an EKG, which is what oldies like myself sometimes say. They're both a tracing that records the electrical activity of the heart, can give you a wealth of information, again, beyond our scope. Ischemia. Ischemia. Ischemia means a reduced or absent blood flow. So ischemia is bad for any organ, but it's particularly bad, as we said, for the myocardium, because if the myocardial cells aren't getting oxygen, your heart's going to quit beating and you'll be dead. So ischemia means a lack of blood flow. Let's see, we went through all those different, we got most of those, I think. There are a few others that you may see. Oh, we didn't talk about what can go wrong with valves. We'll mention those real briefly. I should have talked about it with the valves. So with the valves, there are really 2 or 3 main things that can happen. They can become too narrow through scarring or just getting stiffer over time as you get old. So that is called stenosis. Stenosis of anything means an inappropriate, unhealthy narrowing. So a valve that has stenosis, like aortic stenosis, you can see why that would be bad. If the left ventricle is trying desperately to get blood out to the body through the aorta and the valve is too narrow, it's like having a plugged up faucet. It doesn't work very well. On the other hand, a valve can become leaky or insufficient. It's not doing its job and blood goes when the ventricle squeezes, instead of just going out to the lungs or the body, it flows backwards. And that can cause what we call congestive heart failure, a traffic jam, if you will, of blood. So the blood might back up into the body where it would go to the dependent areas. You'd see swollen legs and feet, or if the patient's lying down, you would see swelling or edema on their back. Or if it's backing up from the left atrium back into the lungs, you would get congested lungs and the person would have trouble breathing, would prefer to sit up. You would listen with your stethoscope and it would sound like an aquarium or a washing machine in there. So those are all signs of congestive heart failure, and there are many causes of congestive heart failure, but insufficient valves are one of them. It's pretty common for a valve to not stay exactly tight when the ventricle squeezes, especially the bicuspid or mitral valve on the left. If you've ever had your umbrella in a stiff wind turn inside out, that's called prolapse. It's when something goes where it shouldn't be. So instead of tightening up, the valve might kind of turn inside out just a little bit, like a cheap umbrella. And it can be so minor that it just makes a little noise, or it can be massive enough that it affects the normal functioning of the heart. But you will hear about patients who have bicuspid or tricuspid prolapse or mitral valve prolapse. A pretty common thing and not always really serious. A lot of young women have a sort of innocent mitral valve prolapse. Let's see, something else came up when I thought of that. Oh well, we have talked a lot about things that can go on with the heart. Blood vessels throughout the body, there's so much to say about them, but we'll just hit a couple of key concepts. Arteries carry blood away from the heart, and that's easy to remember. Artery and away start with the letter A. So the pulmonary arteries carry blood from the heart toward the lungs. The aorta and all its many branches, many of which you may know already, your radial artery, your renal artery, your hepatic arteries, all of them, they carry blood away from the heart. Veins, on the other hand, carry blood toward the heart. So the pulmonary veins carry blood back to the right atrium, and the pulmonary, your vena cava on the right side of your heart bring blood back from the body. So from the tiny veins to the big old veins, like the vena cava, those are all carrying blood toward the heart. Let's see. In between the arteries and the veins, we have capillaries. And capillaries are very tiny, thin-walled vessels. And their job is to allow oxygen to get out into tissue and carbon dioxide to get back into the bloodstream to go back to the lungs to be got rid of. So capillaries are more than just connectors. They are vital in allowing tissues to get the good oxygen out of the blood and get rid of the bad carbon dioxide. So those are the three main elements. Now capillaries, because they are so thin, have a tendency to leak some fluid, and that fluid needs to be put back into circulation. And that's the job of the lymphatic vessels. So lymph is a clear fluid, has some protein in it typically, but mostly water, and your body needs to reclaim that, and it does it through the lymphatic system, which is beyond the scope of our discussion here today. We may touch on it when we get to immunology. I think that's more than enough for one visit. Please email me with any questions that you have, and I hope you'll enjoy learning about the heart this week. Over and out.